And hello and welcome to another fantastic episode of the Digital Health and Wearables series. Before I go ahead, I would like to acknowledge our global partners and sponsors, Spirit Digital. Please check them out in the link with the description below. And also, many thanks to our viewers and listeners. Also, now on the podcasts, feel free to subscribe, of course, in here on YouTube, but now we're also on podcasts on Spotify, Apple, and Google. So, more ways for you to follow our amazing content. But I'm truly excited today, without further ado, to introduce Jeroen Tas, which is the Chief Innovation and Strategy Officer at Philips. He's also a member of the executive board of the Philips Royal. So, hello, Jeroen. How are you?
I'm good. Good morning. How are you?
Good to see you. I think the first memory that I have of you, we met very briefly in the eHealth Week 2016 when you were doing a big presentation, the things that you do best around the Philips stand, and you was very, very busy. I don't know if you remember that.
Yeah, I remember that. And it's good seeing you again, albeit virtual.
Yeah, nice to see you again. And well, we both in healthcare. I follow your great work, Jero. And by the way, the first question that I have for you is, what do you think is the hardest part in healthcare innovation?
That's a very good question, and there are many things that kind of hold innovation back. But before I say that, there is a whole lot of innovation, and the fact that actually we can expect to live much longer than our parents is because of that. We've seen tremendous innovation in diagnostics, from blood tests to imaging to pathology. We've seen tremendous innovation in therapies, heart procedures. We've seen a lot of innovation recently in new types of therapies, immunotherapies. But if you look at it, the innovation of the healthcare system as a system has been, I would say, very slow. And if you look at the Western world, most systems haven't really substantially changed since they were founded after the Second World War. So I think the next wave of innovation will continue, obviously, to get better diagnostic, better therapies, better understanding of what drives health. But at the same time, the big innovation will be the way healthcare is going to be organized. And that means that we have to almost flip it 180 degrees, because right now healthcare is organized around providers. And if you have a problem, your GP will refer you to a specialist. The specialist will do a diagnosis, put you on a therapy, and there may be a little bit of care afterwards, but it's on the terms of the providers. And I think the big shift is going to be, it's going to be about you, and you're going to carry your data. You're going to be referred to the right provider, and it's going to be very, very, very personalized. So the next wave of innovation is going to be truly personalized care and healthcare. But it will be hard to get there because the way care is being reimbursed, vested interests, and it's hard to change an organization. If people have been working the same way for 70 years, who are we to come around and say, hey, you got to change the way you work?
Well, fantastic. So much that you describe in there. Many things to consider, certainly the barriers, the systems, the innovation turning upside down. The second question that I have for you is, Philips traditionally was a lighting company, yeah? And what do you think are the main challenges as a brand and your brand positioning to be seen as a leader in healthcare technology?
I think that's an excellent question. And obviously we're a 130-year-old company, and you cannot stop people from having associations with that brand, that may date back 20 years. But we made a big change, and maybe one of the more fundamental changes in the company a couple of years back, when we said, we're not going to be a generic technology company that's going to find application for its technology. No, we're going to turn that around. We're going to be a health tech company whose purpose in life it is to positively touch the lives and improve the health of billions of people. And actually, we're looking at 2 billion people by 2025. Now, then you're completely changing your purpose, the reason of being, and you need to organize around it. You need to change your portfolio. So we decided to divest lighting. We decided to divest consumer electronics. We now decided to divest our domestic appliances so that we can really focus on that purpose. And along the way, I think we need to prove to the world that we're truly helping them live healthier lives, even when they have disease and they need to be diagnosed. They do it with an MR from Philips that's becoming more precise, that can actually quantify cancer, can be combined with pathology and genomics, which then can lead to a much more tuned a therapy. So we want to march towards that world where healthcare is truly personal, where the diagnosis is truly precise, and where care is tailored to you. And we have to bring, the audience along on that journey and say, hey, we're no longer a lighting company, we're no longer consumer electronics, we're here to help you live healthier lives.
Oh, fantastic. I really love the mission, a fantastic, ambitious mission to touch the lives of 2 billion people. And you have been doing great work the last few years, and I've been following you for quite some time. And the third and last question, Jeroen, that I have for you is: we talked about a lot about self-care in the industry, in the healthcare industry. We need to self-care and the physicians, but where do you see business models in healthcare evolving, and also the role of the patient consumer in healthcare delivery of the future?
Well, I think that's a very good question, because it comes back to what I said earlier. If healthcare becomes truly personalized and it's about you and about your own understanding of your health and the goals you set yourself for health, then it means that you have to get involved. In other words, you have to be conscious about what drives your health, and you have to be probably helped, or if you can do it yourself, drive towards better outcomes. Now, in order to do that, we need to help you get a much better picture of yourself. So we need probably to look not just at, do you have disease? Can we diagnose disease? But are you at risk for certain disease, which can be part of your genes? And I personally have a kidney disease that runs in the family, and I got it when I was born. So now I know it. I also need to understand how I can control it. My daughter has type 1 diabetes. She couldn't help it. It's not a lifestyle choice. It's something that happened, and that changed her life. So once we know what our risks are, once we know what our drivers are, which can be very personal, and you can do that by doing genetic tests, you can do it by doing a heart test, but you can also do by understanding how you eat, how you sleep, whether you have stress, your social life, your education on health. All of these factors come in play, and I think the clinical world has really focused on disease, which is hugely important, because that can be binary, either you live or you don't. But all these other factors can determine how you live your life, whether you can live a fulfilling, healthy life. And I believe these other factors play an equal important role. So when it comes to your own personal health, I think there's a lot of education, there's a lot of guidance, there's a lot of insights, but ultimately you make the choice for yourself whether you want to do something about it. And we've seen also models where the family gets involved. So, for instance, I'm very involved. My daughter is 30 years old, so she's living independently, but still my wife and I are very much involved in making sure that, that she lives as much as possible a healthy life. So I believe that many people also have elderly parents with issues. So I think the role of friends and family will become very important in living truly healthy lives. So it's deeper understanding, and you're the wearables guy, so wearables play a big role in that. And people say, yeah, maybe a Fitbit is not fully clinically relevant. You don't need to have full clinical relevance to understand patterns. Once you understand patterns, then you can help change those patterns if they can lead to positive outcomes. So I think there's a whole lot to do there. And I see also the business models will change to support it. You already see many healthcare systems in the US where they combine the payer and provider role. Now, if you're a payer and a provider, you have a big incentive to keep people healthy, because if people are unhealthy, you have huge downstream costs. You see employers getting very conscious about the health of their employees and basically setting up programs for their employees to reduce stress, to eat well, to deal with disease, with chronic disease. So I think these will be the triggers for change. So employers, combination of payer and providers, and now big retailers getting into the game as well. You're in the UK, and I know that Walgreens Boots is really looking at creating a more healthy retail experience and linking that to care. We see Walmart getting in the game. CVS acquired Aetna. So if a big retailer buys a health insurer, you know that the goal is going to be helping people live healthier lives and avoid downstream, expensive care if that's feasible. So I think there are forces that push us in that direction, and I'm convinced that in a couple of years it's quite normal that it's not about sick care, but it's about smoking, stop smoking programs, is helping people have healthier food, reduce stress, sleep better, all in support of a healthier life and controlling chronic disease.
Brilliant, Jeroen. That was a fantastic insight. You mentioned so much in there. I mean, a bigger picture of the personalized health. You mentioned this not just about the diagnostics. You mentioned the change of behavior, many factors. There was a fantastic answer. Thank you so much. We could talk for hours, as you know. Each question is interesting, and your expertise and the knowledge, we could talk for a long time. But we finished the episode, and I finish all my episodes. This is a bit of a surprise for you in the same way, which is a 1 minute of fame, which you can mention anything whatsoever for a minute. It could be a personal achievement, a family achievement, a professional achievement. It can be anything whatsoever. So, Jeroen, over to you.
Well, I'm at the moment working with David Eggers, who is quite a famous doctor and a great oncologist, but also a visionary on health. And I'm working very closely with him to see how we can not only avoid people, avoid sickness, and but also how to care much better for people when they're sick, have a much more precise diagnosis. And specifically in the space of cancer care, having the right tests after somebody has been treated for cancer, making sure you stay in touch, you help them recover, and you help avoid remission, but going deeper and deeper and deeper in understanding what drives the disease and how you can detect it early and stop the disease as early as possible. But do it in a way that all the knowledge that we build up there will become available to the entire world. So I know that specialized cancer care is really, really the domain of super specialists with the complexity of the therapies. So it will be impossible for a community hospital to always be up to date and to provide world-class cancer care unless you create a digital channel where you bring that expertise, from David Eggers or from Dana Farber that we're working on, and really make that knowledge available to the world. So the democratizing of very high quality care through digital channels, which means can get access to pathways, you can access to clinical protocols, but also to specialists, to diagnostics, to therapy selection. And I think that will be amazing. That will be amazing that if a small hospital in a small town in India or Brazil can actually provide world-class diagnosis and treatment of complex disease like cancer. And that makes me truly excited.
Well, fantastic. Jeroen, what a way to finish the episode with a thing that really will cause a big impact in a major way. I would like to personally thank you for your time. I know you are busy and everything. Thank you so much for doing the episode with us. Nice to see you.
Okay, it was my pleasure. And always good to see you. And
Right.
good luck with your series. Keep spreading the good news.
Thank you so much. I'm going to finalize by thanking the viewers and the listeners. Make sure you subscribe and share the content with all your communities in healthcare. Thank you so much.
Thanks.